And Mark says, I like the idea of using treatment time to chat about things that are relevant to the patient's recovery. It's very easy to use that time for chatting about things less relevant. That perhaps prevents us from sticking to the 30-minute appointments that, 40-minute appointments that you have. Yes, and my wife Claire's always telling me what great conversations she has with patients over the treatment table. She's a bit of a chatterbox, is Claire. But they'll be about music or politics or all sorts of things. But there's an awful lot of useful stuff we can do there as well.
Yeah.
As you've said, in talking about the obstacles to the treatment. And I stopped you after you talked about negativity and confirmation bias. So what else does the book cover?
I think one of the things that, just referring to what is it, Stu had said?
Stu, yes.
Yeah. I think one of the things that I'm trying to get across with it is that in the treatment room, a patient quite often, and I see this time and time again with patients, they don't join the dots necessarily because they haven't got the training to do so and the knowledge to do so. And so they will sometimes come in and say, this happened, my low back's gone, in inverted commas, it went. And I'll say, did you do anything? Did anything happen? What were the triggers? What's the etiology? And they might say, no, nothing at all, nothing at all. I mean, 3 weeks ago I was moving house, but that's fine. It wasn't then. I lifted a box then, but my back was fine. Now it's gone. I don't understand why. Part of the not understanding why is the glue that's holding the problem in place. So we all know about well-trodden neurological pathways and pain pathways. And so sometimes saying, what else has been going on in life and how is life generally and what's happening? And so you moved. Okay, so what was going on with the move? Is that a happy move? Was that a positive thing for you? And what's going on? And then they say, well, at the same time, the dog died. And actually, that was when my son left for university. Just simply saying, wow, that's a lot, isn't it, to have been going through at the time. I wonder if just general stress levels were up. I wonder whether your system was feeling less robust. We all know about stress fatigue in terms of how we cope well in acute situations. Then afterwards, we kind of go like that. So explaining this as a concept is kind of like, you're human. You've got these settings in your system. They haven't been updated for hundreds of thousands of years. So you're predisposed to have a certain setting. And this is you being a human. This is you doing what humans do. And this is how it may have contributed to your pain and why you may have gone acute at this point. And so just bringing that awareness to them, I find sometimes it's almost like you can feel them sort of melt. The glue melts. That glue that was the lack of understanding of the context of why their problem's happening at this point in their life actually melts a bit. And then I feel that the physical therapy gets in on another level.